Welcome to the demo portion of my presentation. I will be talking about making shoulder rehabilitation more effective. When the patient first comes in to the athletic training facility or physical therapy clinic, you want them to heat their shoulder for approximately 15 minutes so the muscles, tendons, and ligaments loosen up within the joint so they get greater range of motion and it's easier for the clinician to work with them. They would come over to the hydroculator, open the lid, grab a hot pack, and with tongs, grab a moist heat pack, put it in the sleeve, close the sleeve, and place it on the affected shoulder. The first exercise we will be performing is wall slides using a towel. You can use a wall frame or a door frame. The patient will do 3 sets of 10 of these, holding for 30 seconds at the top end of their range of motion. The clinician is looking for any pain in the shoulder joint, the acromioclavicular joint, or the glenohumeral joint. They're also looking to see if they have full range of motion. If they have limited range of motion, the clinician will then instruct the patient to stop wherever they feel pain at their range of motion. If this is too easy, this is where one of my unique changes comes into play. My first unique change is adding a 5-pound ankle weight to the wrist of my patient. They will then continue to do wall slides with a towel. Adding the 5-pound weight makes this exercise harder, and it also targets muscular strength endurance as well as range of motion. The next exercise in shoulder rehabilitation is 4-way shoulders. There are 3 different TheraBand tensions that you can use: black, green, and blue. Green is the lightest tension, black is medium tension, and blue is the hardest tension. I'm using blue because this patient is further along in their rehab process. They will perform internal rotation, shoulder extension, shoulder external rotation, and shoulder flexion. This is targeting all of the rotator cuff muscles in the shoulder, which consists of the supraspinatus, infraspinatus, subscapularis, and teres minor. If there is a rotator cuff injury, this is used to help increase muscular strength. It's also used in labral tear injuries to help increase the capsule strength as well. The last exercise being performed in shoulder rehabilitation is I's, Y's, and T's of the shoulder. They will perform shoulder flexion, shoulder scaption, and shoulder abduction. They are using a 10-pound weight and will be doing 3 sets of 15. My second unique change is adding inferential current electrical stimulation and game-ready compression therapy after rehabilitation exercises are finished. My settings for IFC will be 80 to 150 megahertz to help target the whole shoulder joint and decrease pain. I'm also using the game-ready machine, which will be hooked up to a hose onto the sleeve to pump ice-cold water through the patient. This will help decrease any swelling in the area, along with pain that the patient may be having. I'm crossing the stim pads to target the whole shoulder joint and then wrapping the game-ready sleeve around him.